Hi, my name is Nancy Talam. My presentation is about substance use disorder and treatment among adolescents. This is a partial fulfillment for oral comprehensive exam, Colorado State University, Pueblo, summer of 2021. Picot question. In adolescents aged 10 to 19 years with a history of substance use disorder, how effective is family-based treatment in comparison to residential treatment in preventing craving and relapse of polysubstance use within 6 months of family-based treatment? Definition. The definitions used in this presentation are collected from different research materials. The first definition is family-based treatment. Family-based treatment is an intensive outpatient program that seeks to avoid hospitalization and instead actively engages the whole family in the treatment process. On the other hand, residential treatment is a commonly used direct intervention for individuals with substance use or co-occurring mental and substance use disorder who need a structured care. Substance use disorder is a complex condition in which there is uncontrolled use of substance despite harmful consequences. CDC defines polysubstance abuse as when a person abuses more than one substance at a time. Relapse. In the realm of addiction, relapse is a return to substance use after a period of non-use. Craving is an intense desire or urge to use a drug that may occur at any time, but it is more likely in an environment where the drug was last obtained or used. Significance of the problem. Adolescence is a critical developmental stage that involves significant behavioral, social, emotional, cognitive, and physical changes. Understanding adolescent substance use is critical because recent data shows that there has been a rapid increase in the United States in rates of substance use among adolescents. The age of initial substance use has also reduced to about 11 years. United States Department of Health and Human Services mentioned that nearly 70% of those who try an illicit drug before the age of 13 develop a substance use disorder in the next 7 years, compared to 27% of those who first try an illicit drug after the age of 17. Only 1 in 10 people with substance use disorder receive any type of specialty treatment. Therefore, adolescence is a critical at-risk period for polysubstance use. 22% and 22.7% of adolescents have used cannabis products and e-cigarettes. Morse, Liu, and Zhu asserted that the consequences of substance use disorder include illnesses such as cancer and death. Scientific evidence indicates that treatment for substance use disorder, including inpatient, residential, and outpatient, are cost-effective compared to no treatment at all. Case study. Addison is a 15-year-old Caucasian female with history of substance use disorder who presents to outpatient clinic with her parent. She was recently discharged from a residential treatment facility. Her parents are highly concerned that she stopped attending activities she previously enjoyed and is more irritable in the recent days, and are afraid that she might relapse. She previously used alcohol, marijuana, and meth. Upon evaluation by a psychiatric mental health practitioner, she is assessed using Kraft screening tool. She responded yes to 5 out of 6 questions, signifying a high risk for substance use disorder, thus a good candidate for relapse. Evidence table. In this level 1 evidence table, a systematic review and meta-analysis conducted by Lindell et al. Of the 113 participants selected for this study, 57 were treated through family-based therapy, while 56 were treated in residential therapy. The average age was 15.4 years. The independent variables were family-based treatment, residential treatment, while the dependent variable was adolescent substance use. The results were in two phases. Phase 1 is baseline to 2 months, and then phase 2 was 2 months to 18 months. In both phases, the p-value is less than 0.01, which indicates a significant decrease in substance use. However, phase 2 finding shows that family-based treatment maintained their treatment gains, while residential treatment reported significant increase in substance use. In this level 2 evidence table, a systematic review and meta-analysis conducted by Vermeulen, Smith, Van Doomen, and Ingalls of the 532 papers on adolescent drug use, 39 papers describing 22 randomized controlled trials were eligible for inclusion in this study. The independent variable was family-based treatment, while dependent variable was adolescent substance use disorder. The results indicate that family-based treatment has significant effect in the treatment of substance use disorder in adolescents, with a confidence index of 95% and a p-value of 0.018. Research and treatment gaps. There are various gaps in research and treatment. 1. There is a small number of control studies available on this topic. There is also insufficient evidence to assess the balance of benefits between family-based treatment and other treatment for substance use disorder in adolescents. United States Department of Health and Human Services mentioned that research knowledge is limited, however, by lack of attention to cultural, racial, sexual, and gender orientation issues among subjects. Only a few studies have assessed the cost benefit of family therapy or have compared the cost of family therapy to other approaches. At present, research cannot guide treatment providers about the best specific matches between family therapy and particular family system based on cultural differences. Evidence-based practice and treatment guidelines for substance use disorder by American Academy of Child and Adolescent Psychiatry. The first step is recognition of the problem through self-referral and intervention by concerned friends and family to prompt treatment. And then observe an appropriate level of confidentiality for adolescents during the assessment and treatment. And then the psychiatric nurse practitioner is required to do like screening questions on substance of abuse. And then evaluation to determine the quantity and the frequency of use. The toxicology should also be performed as a routine part of formal evaluation and ongoing assessment of substance use, both during and after treatment. And then during treatment, the treatment setting should be least restrictive setting that is safe and effective. And family-based treatment should be a component of treatment of substance use disorder. Treatment programs and interventions should develop procedure to minimize treatment dropout and to maximize motivation, compliance, and treatment completion. Medication can be used when indicated for the management of craving and withdrawal and for aversion therapy. It should encourage and develop peer support, especially regarding the non-use of substance. Program/intervention should attempt to provide comprehensive services in other domains. Psychiatric nurse practitioner should also do a thorough evaluation of comorbid psychiatric disorders such as depression. Addison and family should be encouraged to join aftercare self-help groups such as Alcohol Anonymous or Narcotic Anonymous family groups. Benefits of family-based treatment for substance use disorder. Evidence from research indicates that family therapy approaches yielded larger effects on substance use treatment of adolescents relative to other types of treatment approaches. Another benefit is that family-based treatment uses community resources from multiple systems to discourage craving and relapse by creating an environment conducive to abstinence. Grutadaro also argues that family-based treatment improves adolescents' family social functioning and reduces recidivism. Another benefit of family-based treatment is it helps families become aware of their own needs and provide genuine, enduring healing. It is also highly effective in reducing adolescent substance abuse, conduct disorder, and deviance. It increases engagement and retention in treatment. Theoretical model. For this project, I chose Newman's system model because it can be applied to understand how risk factors or system changes put adolescents at risk of substance abuse and how psychiatric mental health nurse practitioners can support in craving and risk for relapse. Newman's system model is based on a general theory. It reflects the nature of living organisms as open systems in interaction with each other and with the environment. Within the Newman model, the client may be an individual, a family, a group, a community, or a social entity. In this case study, psychiatric mental health nurse practitioner is involved in all the three levels of substance use disorder prevention: the primary prevention, secondary prevention, and tertiary prevention. In primary stage of prevention, the psychiatric mental health nurse practitioner must establish if Addison condition is as a result of craving for a substance. And in secondary level, the psychiatric nurse practitioner must strive to prevent her condition from causing a relapse by controlling the reaction. And finally, in tertiary level of prevention, the psychiatric nurse practitioner will work on treating the condition of Addison. Advanced practice nursing implication. Determine a treatment setting. The setting should be least restrictive and conducive for assessment. Develop a plan of treatment. Psychiatric mental health nurse practitioner develops a plan with Addison considering her ethnic and cultural belief, and this plan must be evidence-based. Coordinate care and collaborate with other clinicians. It is important to involve family as well as other healthcare providers in the treatment process to ensure continuity of care. Provide education to patient and family. Provide education and other resources to Addison and her family that will be helpful in the healing process, such as recovery support programs. Reassess substance use disorder for craving and risk for relapse. This will help in substance use monitoring. And then monitoring psychiatric status and response to treatment. This is important to ensure that mental status and treatment response is checked. And then obtain consultation if indicated. The whole process of Addison treatment involves her family and providers. Thus, consultation is crucial for treatment. Ethics, quality, and technology. Due to the sensitive nature of adolescent substance abuse, it is paramount for psychiatric mental health nurse practitioners to apply ethical consideration when treating adolescents with substance use disorder. The psychiatric mental health nurse practitioner should adhere to therapeutic contract or relationship Addison has with her family. For quality competencies, the psychiatric nurse practitioner should ensure quality of care through consultation, collaboration, continuing education, certification, and evaluation. And for technology competencies, it requires that the psychiatric mental health nurse practitioner is to use health information technology to promote efficiency and high-quality care and to communicate the patient health status using appropriate terminology, format, and technology. Quality initiative and improvement. Clinical and professional leadership. It is paramount for psychiatric nurse practitioner to mentor others in evidence-based practice treatment for substance use disorder. Psychiatric mental health nurse practitioners should lead teams in applying sensitized evidence to initiate clinical decision and practice changes to improve health of individuals and their families, as well as advocating for adolescents. Expert training, coaching, and guidance. The nurse practitioner can lobby individuals, families, groups, community through seminars, grand rounds, and continuing medical education. Consultation, screening, and assessment. It is vital that the psychiatric nurse practitioner conduct comprehensive psychiatric evaluation and work with other healthcare professionals for educational needs. Evidence-based treatment. The nurse practitioner should ensure that evidence-based guidelines are followed. Research skills. Peer review of high-quality care protocol for substance use disorders is important. Collaboration with school nurses and counselors to support adolescents' substance use prevention. Provision of excellent support during transition. The nurse practitioner should provide support through follow-up with calls and text. And then the last but not least is measuring outcome and conducting quality improvement. This will help monitor mental health status and response to treatment. Case study follow-up. Addison was started on an outpatient family-based treatment therapy. She attended weekly sessions for 6 weeks. She stated that, "I do not have craving and urge for drugs anymore." Upon completion of the session, she was reassessed to check for progress using CRAFT screening tool. This time, she answered no to all the 6 questions. She and her family were encouraged to continue with family therapy as scheduled. She was given information and resources where to seek help if needed. SAMHSA National Helpline was one of the resources given to Addison and her family. Smartphone apps such as mHealth and IamQuit were also suggested. Summary. Study indicate that family-based treatment was significantly more effective in treatment of substance use in adolescents. The Newman model system is useful in understanding how risk factors or system changes put adolescents at risk of substance abuse, and health practitioners can support in reducing instability. Backstein mentioned that adolescents with substance use disorder should be treated in least restrictive setting that is safe and effective. Another point is that apply safe, ethical, quality, and technology when treating adolescents suffering with substance use disorder. United States Department of Health and Human Services asserted that individual, family, healthcare providers, private sectors, and government should collaborate to promote treatment of substance use disorders. And these are my references. And thank you very much. Bye.